Hello and welcome to Sharps Disposal Training for Stockton University. This training is designed to equip you with the knowledge and techniques necessary to handle syringes and other Sharps materials in a safe, responsible, and effective manner. Throughout this training, we'll cover the proper tools, safety protocols, and steps to follow when encountering a Sharps material. Our goal is to empower you to protect yourself and others, ensuring you can manage these situations confidently and safely. By the end of this training, you'll be able to identify risks, take appropriate precautions, and understand the steps to safely handle, dispose of, and report found syringes and other sharps. Let's begin and ensure that safety is always the top priority. What are sharps? Sharps are objects with sharp edges or points that can cut or puncture skin. This includes needles, syringes, lancets, and other medical instruments and broken glass. Some uses for sharps include injections, withdrawing fluid, finger sticks, delivery of medication. Sharps can be used at home, work, and when traveling to manage medical conditions. Unfortunately, sharps are often used and left behind by drug users, posing a significant safety risk to others. It is important to use safety precautions when retrieving sharps because improperly handling them can lead to serious injuries, such as needle sticks, which may result in the transmission of bloodborne diseases like HIV, hepatitis B, or hepatitis C. Bloodborne diseases are infections that are transmitted through contact with infected blood or other potentially infectious body fluids. Additionally, sharps can cause physical harm, leading to cuts, infections, and other health complications. By following proper safety protocols, we reduce the risk of exposure to these hazards, protect both ourselves and others, and ensure that sharps are disposed of in a way that minimizes harm to the environment and public health. When handling syringes and sharps, it's essential to never resheath needles, remove them from disposable syringes, or manipulate them by hand, as this increases the risk of injury and exposure to harmful pathogens. All sharps must be immediately disposed of in a portable sharps container to ensure they are safely contained and do not pose a threat to others. To pick up sharps, always use appropriate tools such as forceps, a grabber or picker, or tongs to minimize direct contact and prevent accidents. It's also crucial to wear puncture-resistant gloves to protect your hands from injury. After completing the task, thoroughly wash your hands or use alcohol gel to disinfect them. Additionally, regular annual blood-borne pathogens training is required to keep you informed and prepared for handling potentially dangerous materials safely and effectively. At the Atlantic City campus, the necessary equipment for sharps retrieval, including forceps, grabbers or pickers, tongs, and portable sharps containers, can be found at the Kesselman C106 supply shelving. At the Galloway campus, equipment can be found in Building 70. These designated areas are stocked with all the essential tools to ensure safe and efficient handling of sharps. Employees and staff members should always check these locations to gather the proper equipment before beginning any sharps retrieval task. By using the appropriate tools from the designated supply areas, we can minimize the risk of injury and ensure compliance with safety protocols.
Capital. These are the ones that are the easiest to miss. They've taken the plunger out. Many times they've either bent the needle or broken it off. And now it's kind of just tucked up underneath and you can't really tell if it's a straw, is it a syringe. This is the part we're most worried about. Even with that syringe, with the tip of it bent back, that's still a poke hazard for somebody who steps on it or picks it up or is sweeping up and putting it into a bin. We want these off the street. If you encounter people who are using drugs out on the street and it's, oh no, I always break my needles off, it's okay. I hope that you guys would support us in saying, please don't break the needles off. Now that's in a trash can where I might get poked. We prefer that you leave the needle on. There are people in town picking them up, or you can drop them off at the Oasis Harm Reduction Center yourself. Yes. So we retrieve it. We want to have a good control of it. I always try to pick it up with my needle facing down, because again, if I miss going in this way, I don't want it to come back at me, but I want to make sure that I can do it.
Always use appropriate sharps, puncture-resistant containers that are red or marked with the biohazard symbol. Only use containers that are made for storing, carrying, and transporting sharps. Do not fill the containers more than 2/3 of the way full. Check to make sure there is enough room in the container for the object to fit. Portable sharps containers are to be disposed of into a central sharps depository container. Biologically contaminated sharps must be disposed of as a regular waste according to New Jersey requirements. Stockton University will be responsible for repository container disposal. If you are injured or punctured by a syringe or sharp object, it is crucial to take immediate action to minimize the risk of infection or exposure to bloodborne pathogens. First, wash the wound thoroughly with soap and water for at least 15 minutes to cleanse the area. Apply pressure to the wound with a clean cloth to stop any bleeding. Then, report the incident to your supervisor or designated safety officer and seek medical attention as soon as possible. Depending on the nature of the injury, you may need post-exposure prophylaxis or additional treatment. Ensure that an incident report is completed and follow Stockton University's established procedures for post-injury care, including bloodborne pathogens protocols. Remember, prompt action and reporting are essential to your health and safety. To ensure the safety and well-being of all employees, Stockton offers a hepatitis B vaccine free of charge. This vaccine is highly effective in preventing hepatitis B, a serious liver infection that can be transmitted through exposure to infected blood or bodily fluids, such as during a sharps injury. Employees who may be at risk due to their job duties, such as those handling sharps or working in healthcare-related fields, are strongly encouraged to take advantage of this opportunity. By offering the hepatitis B vaccine at no cost, Stockton aims to reduce the risk of infection and promote a safer work environment for all staff members. When seeking treatment in Atlantic City, please go to the Atlantic Care Regional Center Emergency Room for immediate service. This facility is located at 1925 Pacific Avenue in Atlantic City. If emergency care is not necessary, proceed to the Atlantic Care Regional Medical Center Occupational Health Center located at 3830 Atlantic Avenue in Atlantic City. Please do not give them your personal insurance information. Specify that this is a work-related accident and that your Human Resource Office will contact them the following workday with a claim number. When seeking treatment in Galloway, please go to the Atlantic Care Occupational Health Urgent Care located at 2500 English Creek Avenue, Building 900, Suite 908 in Egg Harbor Township. If it is after hours, proceed to the Galloway Urgent Care located at 110 East Jimmy Leeds Road in Galloway. Again, please do not give them your personal insurance information. Specify that this is a work-related accident and that your Human Resource Office will contact them the following workday with a claim number. In conclusion, when retrieving sharps items, always wear personal protective equipment. including puncture-resistant gloves and pickers or tongs to ensure safety. Follow proper protocols for retrieving and disposing of sharps, placing them in a sharps container that is securely sealed for transport to a designated repository. If you are pricked or cut by a sharp, seek immediate medical attention and promptly inform your supervisor of the incident. For more information on sharps handling procedures or additional guidance on safe sharps retrieval, disposal, and injury response, employees should contact the Office of Environmental Health and Safety with the contact information provided on the slide. Additional contacts and resources are also listed. Thank you to all employees for taking the time to participate in this important training session and for your commitment to maintaining a safe and healthy work environment.